All right, guys, we will jump into it. We are so excited for this webinar today. We are going to be talking about how Brave supports individuals with complex needs virtually. We are joined today by our own Brave Health Chief Medical Officer, Amit Parikh. He is double board certified in both adult and child adolescent psychiatry. So he brings a wealth of knowledge, and we are just so excited to hear from him about this topic today and really dive into how Brave can help with this. So without further ado, I'm going to pass it over to Dr. Parikh to take it away.
Awesome. Thanks for the intro and everybody. Glad you're here. And hopefully this will be an interesting conversation that we can have. And, um, you know, today we're really going to be digging into talking about the people that that our healthcare system avoids the most. It's the ones who don't check the easy boxes, right? We know that uh, a lot of Americans, about half is what our statistics tell us, their mental health needs go untreated. And when you layer on complexity, serious mental illness, recent hospitalizations, co-occurring substance use, trauma, um, care disappears even faster, right? And so it's really about, in our lens, building a system and building a place for these patients. It's building around them rather than filtering them out. And I'm sure we've all had patients who have unfortunately been filtered out of getting the care they need. And we're here to try to fix that. That's our whole kind of concept and ethos here. And it's really about the idea that, right, like even if you have complex needs, you can still get care. We as a healthcare system and as clinicians are here to make sure that you can get access to the care that you need and access in the way that's going to support you despite the barriers that you may have, right? And we know that access doesn't just mean getting a visit, unfortunately. Like I was mentioning, is that, too many patients will get turned away because of that perceived clinical risk of, uh-oh, will this person have a good outcome? Is it gonna impact the outcomes of my company? Or I think they need something else and virtual won't work for them, which is my favorite of them all. And why, right? And so it's really about figuring out what specifically are we saying these patients need? Because I think the reality a lot of times, and I myself as a clinician have sometimes am guilty of this, of saying, this is really complex, this is going to be hard, am I the right person? And that's what we really try to do here at Brave, is to say, yes, you as a clinician, we're going to support you. You can deliver the care you want to. We know it's complex care, but we're going to specifically deliver it for them. And that's why we think of ourselves as a safety net to the safety net. Because the reality is, for most of the patients we treat here at Brave, it's not the difference between getting care at Brave Health or getting care in their community in person or whatever other way. It's either they get care with us or they don't get care at all, and that doesn't feel great, right? And so we want to make sure that we are delivering the best care possible and that we're going to make it easy for these patients to access the care they need. And so if you hop to the next slide, right? And so it's all about uh, building a system in which we really feel that we can deliver the type of care that we need. But quite frankly, it's not just building a system, it's about designing the clinical pathways and the clinical rigor and the clinical clinicians to be able to deliver this type of care, right? And so it starts from the amazing clinicians that are at Brave Health who are the ones delivering care, right? We specifically are bringing people into Brave Health who want to deliver this complex care to underserved populations, right? We want to bring people in who are passionate and excited about delivering this type of care, because we know that it can be more complicated. We know that it can sometimes be harder, but we don't shy away from that. We want people who want to lean into that regardless of the barriers they have. We understand that our patients have, social determinants of health that are impacting them, whether that's housing instability, inconsistent access to food, not having a safe place to live. These are the day to day that our patients are facing. And what we need to do and what we do is make sure that we meet them where they're at. If we know that they don't have consistent access to food, we're not going to give them a medication that you have to take with food, right? And so it's really that idea of figuring out how we set them up for success in the best way possible, knowing that there are barriers in their life that sometimes we can't address. We're going to support them to our best ability as we can, but we know sometimes that there are external factors that are going to get in the way. And so we spend time thinking through, well, despite those external factors, how can we meet them through that and get them the best care possible despite those factors? And so it's really about navigating them through that system. And unfortunately, right, as I mentioned earlier, too many of these patients fall through the cracks because someone will say, "Uh-oh, you're too complex for our outpatient care." And I challenge us all to think about, well, if you're too complex for outpatient care, but you're not complex enough for inpatient care, and maybe you've already done a middle level of care, where are you supposed to go? Right? And it's truly a failure at times of the system of the way that we are setting ourselves up to deliver care to this patient population. And so that's why we here at Brave specifically have developed our services in this way and built them out, that we know that, waiting months for a visit, it doesn't work, right? If you have to wait 6 months to get in to see a orthopedic surgeon because you had a broken bone, you're like, the system wouldn't take that, right? You would see someone quickly. Yet if you have a broken bone equivalent in mental health of I'm having thoughts of not wanting to be alive, right? Suddenly that 6 month wait sometimes is the reality you're faced with. And so that's why we specifically build our services to say, let's get fast access to care. We're trying to get care within a week for most patients who seek it so they can get started in their recovery journey as quickly as possible. What we also know is that the longer you wait to get care, the worse that those symptoms get and the harder it is to treat, right? It's the same medical model that we think about in other disease patterns, but sometimes you don't think about it in behavioral health, right? If you have high blood pressure, if you wait 6 months to get it treated, the impacts of that accumulate over time. Yet it's the same thing in behavioral health. If you're having symptoms of depression, those symptoms are going to worsen over the 6 months it takes you to get into care. And then when you finally get into care, the treatments are more complex. The treatments may take longer to work, and they may involve more intensity. Yet if we had gotten you started in care earlier, we could have avoided that higher intensity of treatment that's needed. We could have maybe used other medications that have less risk associated with them. But because the symptoms got so intense, we had to maybe use certain treatments that had slightly more risk to them, right? And it's the same thing with other kind of disease patterns like high blood pressure, diabetes, etc. Right? And so it's really about redesigning this model to say, yes, we're virtual. Yes, we're going to get you fast access to care, but virtual in and of itself is not less than in person. Because, well, as I was mentioning, and I'm going to repeat it again, um, for a lot of patients, it's not the option between I'm going to get care in a week in my community or I'm going to get care at Brave Health. It's, hey, there's a place in my community that has 6 month wait list. I'm going to wait for that, or I can get care at Brave. And then the other issue is, well, now I don't have consistent transportation, or I lost childcare and suddenly I can't make it to that appointment. And I miss one or two visits because I have to go into a physical office, and suddenly I don't have access to that care, and I potentially am not a part of that practice anymore because of the complexities of my life made it really hard for me to make it there. And that's where virtual care really shines, because especially with the populations we serve, there's so many barriers. And so it's all about reducing those barriers to the best of our ability, and really making it easy as we go. And so our pathways here at Brave are designed and tailored to really meet these complex populations, right? And so, as I was talking about, we have pathways for people struggling with serious mental illness. We have pathways for folks who are struggling with substance use disorder. Many times, those go hand in hand, right? We like to think about patients in neat boxes, and we like to think about people in neat boxes, but the reality is that people are struggling with a host of different things at all the time, right? And so to say we're going to treat one part of you but not the other part, in our view, doesn't make any sense. We look at the person as a whole, right? We have to say what is going on with you and what are the best ways that we can help you. And so if you're struggling with your alcohol use while you may also have bipolar disorder, we're going to treat both of them, right? We're going to say let's work together to help reduce your symptoms of bipolar disorder while also building the motivation, giving you the tools and skills to reduce the alcohol use that you may be using, right? And so it's all about developing this and integrating this multidisciplinary team where here at Brave, we have services across the spectrum. And we're going to talk a little bit more about the services we offer here in some later slides. But it's really about using our integrated approach to make sure that patients are getting the best care possible. And we really think about how do we make sure a lot of our patients have had trauma in their life. And it's really by using that trauma informed lens in every visit and every interaction to understand that our patients are struggling a lot of times. Most of the times when patients are reaching out to us, it's not because things are going well. And sometimes that not going well comes out in ways of things like frustration at the system, frustration at the person in front of you. And we know that that frustration comes from an internal place of hurt and struggle. And it's up to us to help change the narrative that they have maybe created about the healthcare system to say, you can find care that's trauma informed. You can find care that's going to meet you where you're at and not penalize you because of the complexities of your life or the intensity of your symptoms. And so because of that, right, and because we have this acute population, we have to think about things like safety a lot, right? And we have to think about how do we develop treatment plans that have real goals attached to them? How do we develop those outcomes and those targets for our patients so we know when they're better, we know what we're working towards, and to do that we use measurement informed care, right? And so we're doing and using standardized treatment tools such as PHQ-9s, GAT-7s. We're using the Columbia Suicide Severity Rating Scale and a host of others, right? Such as the Edinburgh uh, if they may be pregnant or postpartum. And so we're really thinking and using validated tools to help inform us. Now, don't get me wrong, these tools are not perfect, but neither is just talking to the patient. So the tools help us add extra data points to the conversations we have with our patients to help us develop an understanding of where things are at. Because no tool is perfect, but it's all about using the tool in the right way to understand the the data it's giving you, marrying that with what the patient is telling you in front of you and what you're seeing in front of you to come to the best conclusion. The same way your primary care doctor may tell you, I'm going to take your blood pressure. I'm going to ask you some questions about maybe impacts of blood pressure. And then with both of those, come up with a plan of treatment. And so we're doing the same thing. And that's why it's so important that we're using these types of measurement informed and that we're implementing measurement informed care using these tools to really make our care as evidence-based as possible, so that we can make sure they're getting the best care and have the best chance for success. And so how do we do this? What are some of the things that we think that really enable us to meet this population where they're at? One, it's taking all insurances. right? We don't take a subset of insurances. We don't take just commercial insurances. We take every insurance. We take Medicare, Medicaid, and commercial insurance. That is specifically because we want to meet these people. We want to treat this population as you've heard me talk about. This is who Brave was designed to treat. And so to treat that population, we have to take all insurances. The other reality is insurance for patients changes over their lifetime and over their lifespan, right? You may have a commercial insurance for a year, and then maybe you unfortunately lost that insurance for a variety of reasons. Now you're on Medicaid. Now, because you switch insurances, most places you'd also have to switch your providers and your clinicians. That therapist that you had been seeing for a year suddenly is out of network. That psychiatrist you've been seeing for a year suddenly out of network. And now you have to go retell your whole story. You have to go restart the treatment process to some degree to see someone else, if there even is someone else who's taking your new insurance in your community. That's where Brave Health is shines, quite frankly, is because of our ability to treat patients across insurance companies, despite whatever types of insurance, whether they had a commercial insurance and had to switch to a Medicaid plan, they can keep their clinician, they can keep their same treatment team. That is so important. We know that most behavioral health patients go through many treatment providers because of this. And each time you have to switch, it leads to one more person throwing their hands up in the air and saying, you know what, I'm not doing this again. I'm not explaining my whole story to another person because re-explaining my story can sometimes be a trauma in and of itself. And I'm not willing to do that for the fourth time in 4 years. It's not worth it to me, right? And so it's really important for us to be able to see all lines of insurance. We also thought deeply about how do we make the care as easy to access as possible, right? So we already talked a little bit about why virtual makes sense. If you lose your childcare, if you don't have transportation, it can be easy to miss your appointments. And we all know lots of practices have policies where if you miss so many appointments, you can't be a patient at practice. And so we want to make it as easy as possible for you to maintain your access to care. So how do we do that? we have we have a low tech platform for our patients. In the background there's a lot of technology, but we don't want our patients to feel the technology. We want it to seem seamless to them. So they're primarily communicating to us via text message when they need to cancel a visit, reschedule a visit, if they need to refill the medication. These are all things that they can do over text message, and then we're going to help coordinate that for them, right? And so it's really about making it as simple as possible. And then when it's time for their visit, they don't have to download any apps. They don't have to remember any usernames or passwords or logins. They get texted a link to the visit. They click that link and opens up in the device on the device they're on the browser, and they're off to the races. So we find so often that patients will tell us, yeah, like I had to download an app and then I couldn't make it to my visit, and then it was too complicated for me. We're trying to solve against that, right? And so it's very purposefully for our patients, seems very low tech because they're getting text messages, they're getting simple links. But in the background, we have a lot of technology that drives that, a lot of data that drives all of this to ensure that they have the best chance of success to show up for their visit and actually make it to the appointment. And then, of course, once they make it to that visit, we're going to start tailoring our treatments. And that's what we're going to get into in some of these next slides, is talking truly about the types of treatments that we're able to offer here at Brave. And you can start to see some of those here in the top right. And kind of like we were talking about on the bottom right here, is that idea that, we understand our patients are going to need a lot of outreach at times to make it to their visits. So our engagement engine is going to make sure we're texting them, we're calling them, we're reminding them of the visit. And it's not only that, right? It's not only saying we're going to do a lot of work before the visit to get them and to give them the best chance of success to show up. We're also going to do it once the visit is there, right? Where if they don't show up for the visit, we're not just going to throw, as the clinicians, we're not just going to throw our hands up in the air and say, well, we waited and they didn't show up. We're going to text them if they don't show up within the first few minutes. If they don't respond to the text, we're going to call them. We're going to say, hey, we're waiting for you for this visit. Can you hop on? Are you here? Are you available? Because we know a lot of times they need that extra push. They need that incentive to say, you know what? Yes, let me log on. hey, I got really caught up because something just happened, but let me get to my room to a safe place where I can talk to you in private. And so it's about reaching them where they're at, as I keep talking about, and really trying to make it so that there's as few barriers as possible, right? We understand our patients have a lot going on in their life, and we don't want to penalize them for that. We want to help reach them. And so, what are those types of services? I know you saw a little preview on the top right here. And so, first, we'll talk about psychiatry services we offer, right? And so, we offer quick access to psychiatry and medication management services where we're able to provide holistic care to our patients. Where, for a lot of our patients, quite frankly, we're the only healthcare provider that they see consistently. They may have a primary care physician in their community, but they may not see them that often, right? And so we end up being the primary medical person that they're seeing. And so we take that holistic approach. We're encouraging them when we identify medical complexities to say, hey, you really need to go to see your primary care. You really need to go get these labs done. And hey, let's order the labs for you. So when you go see your primary care, that they already have the first step ready in the process of getting you treatment that you need to help manage the physical complexities that you may be having at the current moment. It's the reality, right? A lot of of the patients we serve just don't consistently see the outpatient medical providers they need to. And so it's up to us to encourage them to go do those things. And so we offer this holistic service. And in certain states, as you can see, we're able to provide those stimulant medications or those controlled substances, which is really important, particularly as we treat a population that's 13 plus. And so in that adolescent population, we know that there's many children who have ADHD. As a child and adolescent psychiatrist, I truly believe that when you're able to accurately identify ADHD in a child, getting them on the right medication can be life changing for that child. And so that's why we're building these types of tools. We're building the ability to be able to prescribe these medications virtually so that those children have access to the care they need so that we can help bend the trajectory of their life so that they have the best chance of success. And so if we hop to the next slide here, we also offer therapy. And we're going to hop through a few types of therapy that we're able to offer. So we offer one-to-one therapy that's typically weekly, right? I was just on a call the other day where unfortunately a social worker told me that in their community mental health agency, which was the only agency in their town that took Medicaid insurance for therapy, when their patients got into therapy, it was typically every 3 weeks or every 4 weeks, just because they didn't have enough clinicians to see the patients. Every 3 or 4 weeks isn't enough, right? That's not going to get you the dose of care you need to get better. And so that's why we're building our services to offer that one-on-one weekly or biweekly therapy so they can get the treatments they need. And as you can see here at the bottom, it's not just about building therapy, it's about building specialties within the therapy, right? It's about building therapists and a therapy team who have experience and specialties in things like acceptance commitment therapy and things like EMDR, right? And so we're really building our services to meet the types of complexities and the types of treatments our populations need. And so if we hop to the next slide here, as I was mentioning, it's not just individual therapy. And as you can see here, we offer those specialties, as I was talking about, EMDR for trauma, dialectical behavioral therapy for people who may be struggling with negative thoughts or self-harm. And we offer that DBT programming for both adolescents and adults, and those are separate groups, of course. We also offer other groups as well, right? And the group therapy that we offer can be quite powerful for our patients. When you're in the depths of struggling with your symptoms, it can feel really isolating. You can feel really alone. And so our groups can give our patients a way to connect with others who are in the same struggle they are in. But where it goes another step is that they get to see people who are in different stages of their recovery. Because if you're at the starting line, you might not even be able to see the finish. It may be completely cloudy to you, and you may not even believe that's possible. But in a group setting, you can start to see that there are people who have gotten closer to recovery, who are maybe halfway to recovery, and you can see and hear their stories about how much better they're doing. And that can give you the motivation of, yes, this is really hard. And sometimes just being honest and saying, yes, this sucks right now, but look, they got better and so can I. And it can really help patients be more motivated to stay in treatment because then they see that it's possible. Because otherwise it can feel like it's impossible. And then finally, family and couples counseling we're also able to offer, which of course, as we know, as we're treating an adolescent population is really important. But just in general too, right? Engaging the people around you in your recovery can be extremely validating, can be extremely important to make sure that you have the best chance of success. And so, as I mentioned earlier, we have to think about safety quite a bit. And we are really proud to be the first virtual organization to have implemented a zero suicide throughout our entire care journey that our patients have. So what does that mean that we have a zero suicide program? That means we screen for safety consistently. We don't shy away from asking the question. We actually think asking the question is the base of what should be expected. We know how important it is because unless you ask, you don't know. And so once we ask, that's just the first step because then we're going to hear about things that the patients may be telling us about. Hey, I am actually having these thoughts. This is the types of thoughts I'm having. This is what I'm thinking. Then we're able to enroll them in our zero suicide programming where we're going to develop treatment plans specifically designed to help reduce those thoughts, to keep them safe. We're also going to enroll them in weekly support groups and offer that to the patients to say, hey, you're having these types of thoughts. We have specific groups designed to help you manage those thoughts. We're going to be reaching out to them in between visits via phone calls and text messages to check in on them, right? Those check-ins can be invaluable because the patients know to expect them. And so they know that someone is going to be reaching out to them. And just knowing someone is going to be reaching out to you can make it just a little bit easier to not follow through with maybe that scary thought you're having. It can help keep you safe for that much longer while we let the treatments we're doing work. And then it's creating that digital safety plan that we make sure the patients have easy access to so that when these thoughts do come up, they have a plan of action, right? And they know how to access it. They know what their safety resources are. They know what resources to reach out to if those thoughts get more intense or scary for them so they can get the quick care that they need when they need it. And so it's about building the tools and about wrapping them around the patient in the best way so that when those thoughts occur, that they know exactly what to do and they have the game plan in place so that they can keep themselves safe. And so to wrap here, how do you make a referral to Brave? It's really easy, right? It takes like 2 minutes, less than 2 minutes once you get used to it. It's an online referral form. Anybody can make a referral. You could be you could be a family member, a friend. You could be the person who's struggling. You could be a primary care case manager. Anybody, right? It really is anybody can make a referral. Once you input that information, we ask you for some basic information about the person you're referring, or if it's yourself. We're going to ask you who you are, who the patient is, if they have a guardian, who that is. How do we reach them? We want to be able to get in contact with them, their phone number, their email, if you have it. If you know what insurance they have, that's great. It's one less thing or one less barrier from the patient because once we have that insurance, we can start validating it on our end just to make sure. Otherwise, we have to ask them for it. But if you give it to us, we can start doing that in the background. Again, right? It's all about reducing those steps, reducing those friction points, reducing the barriers. And then you let us know what they're looking for. If you know, hey, they're looking for therapy. Hey, they're looking for psychiatry, maybe both. And so it's really simple as a process. There are some links here at the bottom, and there's a phone number here too. And so I will pause there. That's the end of our presentation. I know there may have been some questions in the chat that we're happy to answer um, if y'all have a few extra minutes.
Thank you so much, Amit. Appreciate that. I think there are just a few questions here. And of course, please feel free to take yourself off mute or throw them in the chat, and we are happy to answer those for you all. If you do have to hop, please email us at partnersupport@bebravehealth.com with any of your questions, and we will be happy to address those. All right. Dr. Parikh, we have a question here. It says, can you refer them back to their health plan to get assigned to a PCP? Oh, wait,
Absolutely. And that's what we do. So if we screen every single patient when they come into Brave, if they have a primary care. If they don't have a primary care, we're going to recommend that they link with the primary care and say, hey, if you don't know where to go, reach out to your insurance company to find where you can go to establish one.
perfect. Next question is, can the guardian also receive counseling services when the youth is referred? Good question.
Absolutely. And typically what will happen is we won't have them see the same clinician. So, as a therapist, you sometimes can be a conflict of interest to see family members, right? Or, a husband and a wife, or a mom and a child. But because we have a huge clinical team, what we can do is we can have the mom see one person, we can have the son see another person. Those two clinicians will communicate in the back, but also make sure that those patients feel confident and comfortable knowing that that they have their own private space and person to talk to.
Perfect. Looks like one more question. How does Brave handle cancellations and no-shows for providers?
Yeah. And so, if a patient cancels, we're going to reach out to them. We're going to we put a lot of effort into reaching back out to them, getting them rescheduled for a visit. If they no show, as I was mentioning, we do a lot to engage them in that before they no show. We're going to text them, we're going to call them. The clinician themselves during the visit is going to do these things to try to get them to show up for that visit. And of course, inevitably there are patients who are going to no show, or who can't make their visit, and we're going to keep working, and we're going to try our best to keep working with them, right? To try to get them to engage in care, to try to understand the barriers that were present that led to that, and solutioning around them. Maybe it's like, hey, this visit time doesn't work, the day doesn't work, etc. And then helping them to say, okay, like, how do we make sure the next one that we don't run into that same issue?
Absolutely. Sorry, I lied. One more question that just came through. What questions do you use to engage people with serious mental illness?
It's 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 not that different than others, right? Just because you're struggling with serious mental illness, a lot of times it's about seeing you as a person. It's about hearing your struggles. It's about not diminishing what you're going through, right? And what we find is that when you're able to make them feel comfortable by really hearing and seeing them, they're much more likely to engage. And part of that is, in my opinion, is us, because we're virtual, it's us coming into their space rather than them coming into ours in a physical office, right? And so they're inviting us already in some way into their home. And when we are there with them, it can help reduce barriers. What's also interesting about virtual care is that we're able to understand the complexities of their life, right? When they come to my office in person, I don't understand where they live or the types of things that may be happening in their home, but suddenly I'm seeing them in their home. I'm seeing maybe the complexities of that. Maybe I'm seeing that there's a lot of chaos in their home, and I'm starting to put together and really hearing them, building that empathy for them, which I think they're able to really understand and appreciate.
Absolutely. All right, I think that was all of the questions. I'll pause for just a minute in case there's a couple others that want to ask still. Again, take yourself off mute or throw them in the chat, and we are happy to answer those. I will also list our email in the chat in case you want to follow up via email with any questions. Be on the lookout in your inbox today. We will be following up with an email with these slides from today's presentation, along with some helpful handouts, some links as well, just to really educate you and get you set up for success. So be on the lookout for those. But last call for questions. All right, well, I want to thank everyone for joining us today. Thank you, Dr. Parikh, for the amazing presentation and all of the information. If you guys have any questions, please follow up with us. Be on the lookout in your inbox today, and we will be in touch. Thank you guys so much and have a wonderful rest of your week.
Take care, everybody.